Bismillahirrahmanirrahim. Assalamu alaikum. Today's video on high yield pediatrics will be on substance abuse or drug abuse. Substance or drug abuse is really very common in all societies and countries and is underestimated as far as its severity in terms of causing problems within the household, within the family, within the society, and the world in general. So substance abuse or drug addiction could be as simple as smoking cigarettes, e-cigarettes, illicit drug abuse, alcohol, heroin, marijuana. There's so many things which are abused by people. Up to 50% of American seniors, which is high school seniors, which is 12th grade, they have experimented with smoking, and they have also reported to use illicit drugs, and up to 75% have used alcohol. So in Western world, alcohol is readily available because their parents, their adult family members are consuming, and it is available to experiment. And any drug addiction starts with experimentation, and then that addiction kind of engulfs that person, and it's hard to get rid of. The common things, the reason people want to or they start drug abuse is for experimentation. If they want to do it to see how does it feel to drink or to get drunk, or how does it feel to smoke or use marijuana or any other illicit drug. And people who have poor self-esteem tend to do it more. They want to hide their worldly problems in drug abuse and think that this addiction will take away their worldly problems. And one of my friends used to tell me a famous saying that those who drink to drown their sorrow should know that their sorrow knows how to swim. So addiction is an escape from reality, but the reality remains there. You just close your eyes to the danger, and the danger never goes away. So poor self-esteem, psychological problems, depression, poor school performance, poor relationship with the parents, with the friends can lead to addiction, or to impress the friends, or to do it under the effect of peer pressure. Because your friend is smoking, your friend is drinking, you might as well do it too, to become socially acceptable. So this is another reason that people start using these drugs, or to fight against a person of authority, a parent, a teacher, that okay, my father is upset with me, I might as well revolt and start smoking, start drinking, start using drugs. Or if I'm being ignored, that okay, someone is ignoring me, let me drown myself, let me forget myself, and probably by that I'm gonna forget that other person. The other thing is socially being acceptable. Sometimes in some societies, the media projects these smoking ads. It has come down, but used to be very common, or may still be common in underdeveloped world. In the movies, heroes, they smoke to look cool. So the boys or girls, they may smoke to look good, to be socially acceptable. It's a nice thing it's cool to smoke or to vape. It's really cool, it's in. This media industry has its effect on smoking as well. Then there is smokeless tobacco, like vaping is very common, because in the schools you cannot take the regular cigarettes. They vape, they take those liquid nicotine cigarettes, and no one knows that they are vaping in the bathrooms, even the classrooms. So this vaping has also become a big problem. And in some societies, states, where marijuana is legalized, or in countries where it's readily available. People start with marijuana. They may go up to morphine, or they may go to heroin, which is highly addictive. And I remember one of my teachers saying that even one cigarette of heroin could cause drug addiction. And the commoner symptom of drug addiction is seeking the drug. Their mind is preoccupied with getting their addictive substance. Even smoking, those people who are fasting, or who are in the school, who are in the meeting, they want to get out of there and smoke, and they just go out, take a bathroom break, smoke somewhere. You may have heard of alarms going on in the buildings, in the schools, even in the aeroplanes. People smoke, and the smoke detector alarm goes off, and those people are taken off of the plane. So those things happen. Or people have erratic behavior, and those erratic behaviors can lead them into trouble. And then their mind is preoccupied. And to stay normal, they need to smoke, they need to use marijuana, they may need to use heroin, or they may need to drink to stay normal. So those are the profound states of drug addiction. So once you recognize that there is a problem of drug addiction, how to get rid of it? So anti-smoking cessation programs, awareness of the side effects of the problems related to that specific addiction, from cancer of the mouth, larynx, lungs, urinary tract. All those cancers are caused by smoking. Smoking can cause damage to the lungs, chronic obstructive pulmonary disease. People, they ruin their lungs. And in today's age of COVID, those people who have chronic obstructive airway disease, they are in high risk. They can have plenty of complications because of this virus. Peptic ulcer disease. People, they have indigestion. They have stress-related ulcers in their stomachs. Pregnancy related complications. The baby could be small, they could be stillbirth, the baby could die, the baby could have serious birth problems or withdrawal at the time of birth, for example, methadone or heroin addiction. The babies can be taken away from the parents if they're found to have substance abuse in their blood or in their urine. So those are a serious issue. Coronary artery disease. People are dying at a young age who are overweight, have metabolic syndrome, their cholesterol is high, and they are smokers. So that is just putting fuel to the fire. So there are so many problems that people can be made aware of, and they could be told to join the smoking cessation programs or to join the drug addiction programs in which you could get out of drug addiction. So those treatment programs, they can help you, or rehabilitate. Drug rehab programs, they can rehabilitate you to the society. So we hear a lot of celebrities going to drug rehab programs, alcohol rehab programs. So those rehab programs, they really help in people getting rid of these habits. Alcohol in itself has so many problems, from eyes, skin, social acceptability, rage-like reactions, accidents because of being on the effect of alcohol, cirrhosis of liver failure, intrauterine damage to the fetal alcohol syndrome, damage to the fetus, vitamin insufficiencies, brain damage, late encephalopathy, Wernicke's encephalopathy. People may also develop Alzheimer's at a young age. They lose their intellect, their IQ, their memory. Everything could be ruined. And drug addictions like cocaine, heroin, they could be deleterious to your health and may cause early heart disease and death. So to identify these drug addictions is very, very, very important, and they could result in decline in school performance in the kids, in the teenagers. So parents should be on the lookout They may have problems with their friends. They may have episodes of fighting within the family, with the friends. They may break their relationships. They may become hostile, or they may be absent in their communication. They may not be able to communicate. So those are the red flags for the parents to identify an underlying problem to prevent it. They may have weight problem. They may lose their appetite. They may start losing weight, and ultimately it leads to depression, self-isolation, and decreased participation in social activities, social programs, and they stay preoccupied with the addictive drug. So these are the most important things, which have to be carried out in order to identify. And this urine drug screen or blood drug screen test can identify, any child, any teenager, any adult with an erratic behavior appears, loss of consciousness in the ED, in the ER. Their urine for drug screen can be carried out, and the proper addictive substance could be isolated and treated. To discuss every addictive substance is hard for me in this short video, but those are the main points that you have to remember. And just a touch on vaping, which is was very prevalent and still may be very prevalent in some states. There have been restriction imposed, but people can buy it online, or their adult people can buy for them. And even those people from in US who are desis, they have own gas stations. Kids, they're teenagers who work and help them. They may steal from them and may sell it. So this is a very common phenomena in the country, in US and globally. And the amount of nicotine that you inhale because of vaping is profound and much more than the regular cigarettes, and can cause profound damage to the lungs, can cause respiratory distress syndrome, pneumonia, respiratory failure, and death. And especially with COVID-19, anyone who has a compromise, even the healthy people with a normal lung, can be affected by the virus. And those people who already have damaged or suboptimal health of the lungs can have serious problems with their oxygenation, may lead to respiratory distress, ventilator need, and ultimately death. So please watch the telltale signs in your children, in your colleagues, in your family members, to identify their drug addiction problem and help them go to rehab programs to get out of their drug addiction and to become useful for their family, society, and the world. Hopefully this talk would be useful. Just a taste of how to identify and manage drug addiction. Please like this video, share it with your friends, and subscribe to my channel. Have a good day. Allah Hafiz. Sallallahu alayhi wa sallam. Assalamu alaikum.